Hey, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes, and today we're going to start getting into neonatal resuscitation. Um, this is kind of going to be a quick kind of pass through this topic. It's only going to be a few videos, but I want to start out with things like age of the patients, weight, and mortality of neonatal patients that we encounter in the field. Of course, before I get to that, I always want to talk about why this stuff is important. And of course, we know it's important for our exams, right? To have these key elements so that when we take our exams, we know what we're looking for. We know what to answer on the questions, right? But it's also great when you want to build your knowledge base, when you want to know more about what it is you're actually doing out there in the field and understanding and putting these pieces together when you're taking care of your patients. This helps you make better clinical decisions, make better transport decisions, helps you when you fill out your reports and your interactions with other healthcare professionals. So let's get into today's topic, guys, right? We talk about neonatal resuscitation, and there's some age ranges you want to look at. Okay, we have our newborn. This is usually the first few hours of life, right? This is our newborn patient. Okay, then we've got our neonate, and that's about the first 28 days of life. Okay, and then our infant, and the infant is any time after 28 days, but less than 1 year. Okay, so this all kind of ties into how we're going to care for the patient, what we can expect, what the statuses are, for those patients, what the percentages are as far as their mortality, okay, and things to sort of think about when you get calls for these patients, okay, to kind of recall what percentage of these patients might not make it or struggling, or you might have to deal with more aggressively, okay, and that comes into the gestational age, right? So we talk about gestational ages of these patients. We've got a premature patient or preterm, okay, those preemies, those are born before 37 weeks. We've got the full term patients, that's about 38 to 42 weeks of gestation, and then our post mature. These are the patients that are kind of carrying the patient past the delivery date, right, over 42 weeks. Okay, so those are most of your gestational ages of patients that you're going to encounter, and each one of these will determine how you treat your patients, right? Because what happens is if you've got patients that have low birth weight, things like that, you might not be able to resuscitate them. Okay, there might be more supportive measures. Okay, going to the hospital. Okay, 6% of deliveries usually require some sort of life support by you. Okay, and like I just said, complications are increasing when birth weight is low. Okay, and the lower the birth weight, they're kind of 20 times more likely to not make it. Okay, to die on you. Okay, so of course the best chance of patients are the ones that weigh 3,000 to 4,000 grams, right? And they're over that 36-week mark. But when you get lower, like our low weight, less than 2,500, our moderate weight, which is 15 to 2,500, but then we get really low, less than 1,500, less than 1,000, right? That's when you're going to start having some issues, and when that mortality starts to rise. Okay, so I want to talk a little bit about this mortality guide before we round up today's episode. Okay, we got our live births, right? Those are the neonates that they're born. Okay, they have signs of breathing, they've got a heartbeat, and they have some sort of voluntary movement. Okay, then we have our fetal death, and this is when the neonate is over 20 weeks in gestation, before delivery. Okay, and then there's no signs of life after they are born. Okay, then we've got things like SIDS and stuff like that, right? That early neonatal death. A lot of times it happens within the first week. Okay, and then you've got the first week to about 100, first week to about 28 days. That first 28 days is can be really rough, especially again we go back to those birth weights, right, and the risk of their birth weight, okay, and the risk of them having an early neonatal death, okay, within that first 28 days increases, okay. Then we have a postnatal death. Okay, this is after 28 days. These are again your SIDS patients, right? Anytime between 28 days to 1 year. Okay, so all this kind of ties in, guys. Think about the birth weight, think about complications of the delivery, think about how early or late they were born. All this sort of ties in, okay? So things to kind of consider when you encounter these patients in the field, okay? Or when you're delivering a patient in the field that might be a neonate, finding out how far along the mother is, complications, if there was anything seen on, last, scan the baby, things like that. Okay, so guys, that's it for this episode. I don't want to get too deep into the weeds here. Next week, I want to talk a little bit about life outside. Okay, the initial life outside of the mom. Okay, before we get into distress and stuff like that. Okay, I want to kind of keep these nice short chunks for you so you can kind of really latch on to some of this key content. So when you see the stuff on exams or you encounter it in the field, you'll be able to deal with it much better, and this stuff will ring much more true for you. So, guys, as always, try to engage with me. I'm on all the social media channels. I'm on Facebook. I'm on Instagram. I'm on Twitter. All right, these are my handles there. It's at EMS Safe on both Twitter and Instagram, and I am facebook.com/the EMS Professional on Facebook. Guys, you can always contact me as well via email. My contact information is contact@emsofficehours.com. Guys, send me your Monday Minute stuff you want to see or interested in here seeing on these videos. You can go check out all the previous videos and all the stuff that's been going on up until now on YouTube at the EMS Professional YouTube channel, or you can go directly to emsofficehours.com, see all the videos there, plus the podcast. Guys, that's it for me. I hope you've enjoyed these. I hope you can get some sort of a takeaway on this content. As always, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.